So after I graduated Northern Caribbean University, I felt like I was well prepared to go into the working world, because if you are from Jamaica and if you understand our system for nursing program, how it is set up, we get a lot of experience working in the hospitals, the clinic, the community, and nursing homes as a part of our program. From year one, I'll tell you a little bit more about how we go about doing that. So in your first semester at Northern Caribbean University, it's an introductory period. The second semester, we go into the hospital and we observe. During that time, you're able to do like blood pressure, you can do temperature, but using the one with the mercury. So you have to know to flash it down. Try not to flash too hard, because if you flash too hard and it's slip out of your hand, that's a big issue, because then the mercury is like spilled all over. So they show you how to gently flash down your little thermometer, so that way you can actually get the temperature correct. But certainly the things, bed making, offering a bedpan or anything like that, you'll do in your first semester, and you'll just observing, and that's on Fridays. And then in the first year, which is your official year of your nursing program, is when you start doing like additional clinical hours, probably like 2 or 3 days per week with your didactics or your classroom portion. During the summer of your first year as well, you would have had done phlebotomy, where you do blood drawing, bloodletting. You're able to start IVs, collect your blood samples, and that works out so perfect when you're in the nursing field or working as a student nurse, because now you're able to put in your IV, get your blood work, along with all the other procedures that you would have been able to do. And just imagine you as a first year student knowing how to do all of those. It is so beneficial for the nurses on the floor, because with us being short staffed in Jamaica already, having extra nurses on the floor who are pretty competent at certain other things is just going to be very helpful to the nurses, because you're able to do catheters, you're able to do dressing change, you're able to do NG tubes, IVs, blood draw, medication, assessment. So from your first year, you're functioning, you're fully equipped to take care of a patient with under supervision of your nursing staff. And so that was just something that I really admire about the Northern Caribbean University program, as well as other nursing programs in Jamaica. They prepare you to the point where you feel competent at the end of your 4-year program or 3-year program to take care of your patient or to practice independently. I know that we did a lot of clinical hours, impromptu visits by your directors or your clinical preceptors. They'll come in, and then you have to literally walk through certain procedures with them. You have to show them how you go about medication administration. They look at your notes, care plans, and all of that. And when it's time for management, you get the opportunity to work as charge nurse, making the assignments, delegating assignments to other staff as a student nurse. And you get a chance to work the night shift, the day shift. So that way, by the time you're finished, you have already worked your way through every area or every aspect of what you're anticipated to perform as being a registered nurse in the field. And so after graduating Northern Caribbean University and started working, I was very confident. I was very comfortable with how my approach to taking care of patients. At that time, you're now independent, and you're going to have to just find your 1 or 2 little ways of making your shift go by without having any death on your shift, or any patient, decompensating on your shift, or having any errors, because now you are working on your own license. And so that was just something that I really admire. I had looked forward to at the end of my nursing program, because I felt like the program had equipped me to become, successful in the working world. And then as you go along and start working and then transition to the US, it was a pretty transition, because the program in Jamaica is internationally recognized. So the standards of practice are similar to the standards in the US here. So the transition is not that bad, or is not difficult for persons transitioning from Jamaica.